Dr. Hawkins, how you doing?
I'm doing wonderful today, Shannon. I think we're getting excited for fall. We're getting excited for the middle of the football season.
Boy, can you believe it? Middle of the football season. Let's see, we're talking week 6. What a big weekend. You know, I think you and I last time we chatted a little bit talking about start or sit here, folks. This is where Dr. Hawkins and I chat about the injuries that occurred in the previous weekend. And is your fantasy football player going to be able to start or sit? What are you going to do? How are you going to do it? Why are you going to do it? And this is why you're listening to Start or Sit today. And you know, it's interesting. The parity, and you look at some of the divisions right now. I mean, a lot of people. I mean, it's pretty equal. There's only one team undefeated. Can you tell me who that is, Dr. Hawkins?
Well, our one undefeated team. It's got to be the Philadelphia Eagles.
And where are you from, Dr. Hawkins?
That was my home for 20 years. It's my wife's home. My wife's home for 50 plus years. So it burns a little deep for her.
Is she wearing her Eagles jersey around the house and just rubbing it in? What's the deal there? She's pretty excited. Eagles fans are rabid. You know that, don't you? I mean,
yeah, they're super excited. That whole side of my family is going nuts these days. But they also don't like to be told that they have the best team going because they are also very fatalistic. So they're worried that things are going to change.
There you go. Well, congratulations to you and your wife, particularly. That's pretty cool. My bucket list is to wear a Dallas Cowboys jersey into Philadelphia Stadium and see if I get out alive. You know? So
that is absolutely probably one of the worst choices you could make.
Maybe I'll have to come see you once the game's over. I have to come see the greatest orthopedist in the Olympia area. That's Dr. Hawkins. Okay, so here we go. Let's talk about Randall Cobb, wide receiver. Man, this guy, I mean, boy, Packers are having a tough year, I think. They just lost, who'd they lose to? The Jets. The Jets beat the Packers. And wide receiver, what has he got going on? It sounds like he's out 2 to 4 weeks with some kind of lower extremity injury. What is that?
Yeah, he took a bad injury on the field to the point that they actually took him off on a cart. Towel over his head. He was in tears going off the field. Again, the assumption at the time was that I think they thought he might have had a fracture. Luckily, they took some x-rays on him, and he did not have any type of a fracture. So with that much pain, but still having a 2 to 4 week timeline, you're probably dealing with that sort of low ankle sprain injury. Those things can be really painful. They can mimic a fracture because they can swell a whole bunch right away because of bleeding, and they're really tender over the insertion of those ligaments, which is right where a fracture can occur as well. So that's probably why they sort of kind of, whoever saw him on the field probably said, hey, I think you might have a broken bone here, and he probably thought the worst. But as we've talked about a few times before, with the right kind of rest, the right kind of protection of those ligaments, that's why he could be somebody who's going to be back in a few weeks. But unfortunately, as we talk about the start or sit, he's going to be a sit this week if he's on your fantasy team. Yeah, he's definitely a sit. I mean, what I've read with that type of injury and the type of injury, I mean, he may be sitting for somewhere around 2 to 4 weeks. Because again, we also talked about this before. It's a little bit of a biology. I mean, he obviously is a great athlete. He's going to get a lot of resources. They're going to work a lot on anti-inflammatory, promoting healing. They like to get him back. But again, you got to let this tissue heal so you have some stability. I mean, talk about maybe, an athlete like that as they heal, they're going to take him out and they're going to take him through a lot of, this guy's got a cut, stop, twist, turn, leap. He's got a lot of aggressive activity. So they're going to assess that functional activity as he gets back to play possibly. So yeah, exactly. Your foot is your platform as you speak. So, if you've got a 3-legged, stool that you're standing on, an ankle that's less stable, you're going to tip over a lot easier. So that's going to be really important, like you said, to make sure he's coming back. Yeah, absolutely. So he's probably at least out this week. Maybe keep an eye on him. 2 to 4 weeks is kind of the range potentially for him. Here's another gentleman I feel sorry for. I mean, this guy came out of college, got drafted. He seemed to be on kind of a rising star. He's struggling a little bit the last couple of years from what I can see, and that's Carson Wentz. He's got a fractured ring finger, I mean, so tell us what's going on there with that fractured ring finger. Is that his throwing hand? Do you remember? It is his throwing hand. So the interesting thing is he actually fractured it in the game and continued playing.
Oh.
He finished out the game with the fracture. So obviously it tells you a little bit about how tough this guy is. Different than, say, Dak Prescott. It wasn't a thumb injury, so that ring finger, being between, obviously, your middle finger and your small finger, you're probably still able to grip the ball. But if he had any fluttering passes towards the end of that game, now you know why, because he can't control the spiral. He's on what looks like sort of a short recovery. He had surgery, I believe, 2 days ago on the finger. So when they operate on it that quick, and they say it's going to be 4 to 6 weeks coming back, it's probably pretty clear that he had probably a short spiral fracture of one of the, probably either his metacarpal or maybe one of the phalanges, the smaller bones in the finger. But basically, they were probably able to put it together with some screws that really hold it very securely. And that's why, as long as things are healing well after 4 to 6 weeks, they can start to, he can start to grip and throw. But again, his mechanics may not be great. His control might not be great. So he's definitely somebody who's going to be out for a little while. And even when he comes back, he wasn't a top tier quarterback in fantasy. So, it's time to start looking for other people.
Yeah. Start looking around. It's interesting. I mean, probably in the normal population with this type of injury, that spiral fracture of your finger, I mean, in a regular situation, most likely that would be splinted and you would let it heal. But I'm just guessing here with a high caliber athlete, the surgery and the intervention of the surgery is to help stabilize it and promote healing so that athlete can return. Is that fair to say? I mean,
Yeah, I think you hit it on the head. There's definitely a different standard with these higher level athletes and wanting to rehab them more quickly. That being said, if they can do these things now with just a few small screws, and they don't need to put like a large plate on it, even some normal Joes like you and I will oftentimes benefit from fixing it, because you can start the rehab and get the mobility back a lot quicker, and hopefully not have issues with like grip strength and stuff like that over time. So it really allows the therapy side, as to get active a lot quicker sometimes if things are stabilized.
Right. I mean, good point. And the surgery that you folks are doing today, orthopedic surgery, whether you're a hand surgeon or spine surgeon, it's minimally invasive. So you're trying to eliminate as much of the soft tissue disruption or damage. So you're trying to get in there with minimal inflammation. So the techniques have improved significantly since I started doing this physical therapy stuff about 35 years ago. Marquise Brown, Arizona. This is the team that our Seattle Seahawks, put a pretty good licking on. But this guy's pretty impressive. He's got a foot fracture, non-displaced foot fracture, I think I read. So it sounds like it's. What do you think here?
Well, he's a speedster. That's
no doubt.
His nickname is Hollywood, so he requires some vertical speed, and they have been a little close-lipped about where exactly his fracture was, but we can extrapolate it out a little bit. Originally they thought this was a season-ending injury. He's on my son's fantasy team, and right away he was like, all right, he's gone, so we're going to pick up, the next wide receiver on his team. But now they're saying 6 weeks. So my assumption is they thought this was either a Lisfranc injury. Mm-hmm. We've touched on that before, where there's disruption of ligaments in the middle of the foot, and those things take a really long time to heal. My guess is they got an MRI and saw that the ligament in there is not disrupted. He probably has a small chip fracture of one of those bones, and the ligament didn't come off with it. So it's going to be the classic, treat it like an ankle sprain, rest it, immobilize it a little bit, start some rehab for motion after a week or so, and hopefully should heal uneventfully and not affect his ability to come back this season in the next 6 weeks or so.
Yeah, and so this is a guy that most likely we're looking at, I mean, conservatively 4 to 6 weeks, most likely. I mean, that's
exactly. I think because of his need for speed, legitimately, it'll be 6 weeks.
Yeah, absolutely. So when you talk about it, I mean, I like how you described it. Just for our listeners, when you describe a chip fracture, what you're seeing is, it's not a fracture that goes. It's just a piece of bone that kind of avulses or chips off, so it's non-displaced. So there's nothing to really pin. If you can stabilize it or immobilize it, that chip will repair or heal back down to that fractured bone site, and he should be able to recover. Is that?
Yeah, exactly. It's not a structural component of the whole bone. That's the best way to think of it. So, it's not going to affect the ability of that bone to hold its shape, hold its position, and everything around it. And quite honestly, sometimes you see those things, down around the ankle where somebody sprained their ankle a few times and they've just got what looks like old little bone fragments that look like they're floating down there. But everything's kind of healed from a soft tissue perspective, and you don't worry about them. They're never an issue or anything like that.
I was just going to say we'd all probably be surprised if the normal person had MRIs of certain joints that were injured in the past. You probably have little chip fractures. You just were commenting on that. Hey, just real quick, concussions are, they're another universe. They're a huge topic, particularly in today's NFL, any contact sports, particularly with Tua supposedly returning here pretty quick, maybe this weekend. Kenny Pickett kind of sustained a concussion. He's going through the protocol. Maybe we can just talk about that. Do you think he's going to be back, or is Trubisky your guy? I mean,
well, that's a tough one. So Kenny Pickett's a backup on my fantasy team, so I want him to play. But that's me being selfish.
Yeah.
But the reality of it is after what happened with Tua, they changed the NFL protocol, and they essentially say, if they see anybody who has any unsteadiness, so if the spotter sees any issues with regards to getting up after a hit and shaking your head or stumbling, you're immediately pulled from the game and you go into the concussion protocol. So you may have something like that where he's a little out of it, got up, he's out of the game, but he didn't actually sustain a major concussion. They're erring on the side of caution here. So I think he's going to be able to play. The problem is Trubisky came in and had a decent game after him.
Yeah.
So they're going to go in that direction, but I wouldn't be surprised if they let Trubisky play this game and have Pickett just kind of rest another week so that he doesn't end up with that sort of classic second impact syndrome where you have a head that got jelly shook, up a little bit once, and then you shake it up again and bruise the brain essentially a second time, and then maybe you do have symptoms that keep you out for a longer amount of time.
Yeah, one of the things we do know, and you just mentioned the second impact, but we also know that, they're very sensitive and very cautious with cumulative, repetitive trauma to the brain. I mean, that just adds up, kind of almost, multiplies significantly, and that's kind of the problem with this CTE. So they're very cautious. So he may play, but they're in good shape with Trubisky. But if you have Kenny Pickett for some reason as a backup, you might be wondering if he's going to be out there. Okay.
Yeah.
Here's a guy here. This is the famous, the turf toe, right? This is Kendrick Bourne, New England. Turf toe, boy, that's a big one. That can be a season-ending injury. Obviously, multiple weeks. What's going on with that toe, you think?
Yeah, exactly. So we've touched on it a few times in the past, how these speedsters require a lot of force through their lower extremities. So with a turf toe, it's an injury to the plantar plate, or the thick soft tissue that's underneath the base of your big toe. So that's what you need to push off from. Their concerns with him was that this was a rupture of that plantar plate. The classic turf toe injury that keeps people out an extended amount of time. As we know now with these NFL guys, they get tons of imaging done very quickly, and within a day, they basically said he's only going to be out a week. So he probably had pain there, might have had a little bit of inflammation, but probably no structural damage. So that's a good sign. They'll probably put him in a really thin carbon insole that kind of limits how much over bend, or over flexion you can do at that joint, and still give him some of that ability to rebound and push off of it, kind of like, an amputee runs on a carbon blade. And so that's how those guys can still come back even when they have that injury on the bottom of their foot as long as they didn't tear it.
Yeah, right. But I mean, it's interesting because from a mechanic standpoint, just kinesiology, you have to think about this. When these athletes are out running around and they're exploding off that toe and progressing themselves up in the air vertically, that toe is extending like 40 degrees. I mean, it is really taking a lot of extension. And if that bottom part of that tissue is inflamed or torn, you just can't do that. It's just not going to happen, right? I mean,
yeah.
It's one of those injuries. Now, I think if I remember right, growing up, I had my favorite was Jack Ham. He was a middle linebacker for the Pittsburgh Steelers. I think I think turf toe ended his career after chronic turf toe. He had to give it up. Yep. So good. He's going to be. Is he going to be playing or? I
think he'll be. I think they'll sit him this week completely. So you'd sit him on but keep him around. They're throwing the ball well. Their new quarterback Zappy is riding the wave these days. So they're saying Mac Jones may get booted out because they've had that history. Bledsoe got booted for Brady.
That's right.
Yep. They booted Kozar out for Vinny Testaverde when he was with the Browns. So he's not shy about saying, all right, you're out as a starter. Yeah. We're going with this other guy.
Yeah, gut feeling. I mean, hey, Bledsoe makes pretty good wine over in Walla Walla now, though, if you've ever...
I hear that.
Yeah. Okay. And he's a Coug. Go Cougs, just real quick. I'll throw that out real quick. Hey, a couple hamstring injuries. Monday Night Football, obviously, Russell Wilson reported after the game that he felt he tweaked it, I think, the first half or the third quarter. And, he also has that lat tear. But Russell Wilson, and then, geez, talk about heroics. I mean, this guy was amazing. I mean, what is it? Dustin Hopkins, the kicker, comes out. I mean, every time he kicked, he fell flat to the ground. He had so much pain in his hamstring, which appeared to be hamstring strain to me. Tell us about those two guys.
Yeah, so for Russell, he's been kind of battered and bruised this season. Last week we touched on that lat injury a little bit, and he actually had some platelet injections done to that to try to accelerate the healing. Russell did get an MRI done. It sounds like there was no structural damage to his hamstring. So he's probably actually approaching it the same way. A lot of these aging athletes will go with some of these sort of biologic treatments to try to accelerate the healing. There's probably not a huge downside to them. If you're regular like you and I, the downside is they cost money because no insurance doesn't cover them.
Exactly.
But he's probably getting that done, I would assume. Hopkins, that was a gutty situation. I agree. And when you look at it, a lot of people are thinking, geez, he's a kicker. It's his quad. Why is he having such issues? Well, they create an amazing amount of force through that hip joint and extending their knee. And you're basically, your hamstring is your decelerator. Right. It's like the airplane landing on the aircraft carrier and hitting the wire that stops you from going over the edge. So every time he kicked, basically the bottom part of his leg tried to fly off. Yeah. And he didn't have that deceleration. So that was a miserable thing, but he was great. I don't know if you saw his post game. They talked to him on the field. Yep. Sounds like literally one of the most gracious, nicest guys in the world.
Yeah, I can't see him kick. I mean, do they have a bye? I can't even remember. I mean, we're talking about, this kicker. If he's got a game this Sunday, there's no way he could kick. I mean, I just don't see it.
I don't think there's a chance. They haven't really given anything official on it. Yeah. But he was coming off missing a game before that for a quad strain. Right. So, he's clearly that situation we talk about where, you might get better, but you kind of overcompensating maybe in another way, and you get another injury. So I wouldn't be surprised if they've got somebody that they can bring into camp, because they didn't have a backup kicker. That's right. If they have somebody they can bring in that they like, I think they'll probably try to rest him like 2 or 3 weeks at least.
Yeah, I think he's a rest. I would agree with you. I think the Dustin Hopkins is a rest. Russell Wilson, he's Iron Man. I mean, he's only missed 3-4 weeks his entire career, and that was with the Seahawks. I think last year when he had that jersey finger. I bet he's going to play. He's probably day to day, but I bet he's going to play this if they don't have a bye. I don't think they have a bye this weekend. So there you go. Anything else? That's a pretty good roster. Dr. Hawkins
ran through it today.
Yeah, we did.
It was a good one.
Yeah, it was a really good one. Hey, go Eagles. Okay, how about that for you? I got to go Cougs. I'm going to give you go Eagles, and we'll talk next week. Okay.
Yeah, it sounds good. And listen, if you're gonna cheer for the Eagles this time of year, you got to throw since the Mariners are out, you got to throw the Phillies in there now. Okay.
Okay. Yeah. Philadelphia. That city.
Yeah, they're riding high right now. They're already talking about the Sixers winning a championship. So,
and I think the Flyers are off to a good start in hockey. I mean, aren't they?
They're kind of riding. They're riding them all right now. They'll believe me that they'll turn on them in a second though once things go bad.
Okay, that's true Philly fashion. They don't even like Rocky anymore. Okay, no, I'm just kidding. So, all right, take care, Dr. Hawkins. Have a good one.
All right,
bye bye.